Welcome to this KQT Health presentation for the 2024 ALS Medication Update Program. Please adjust your device volume so that you can comfortably hear the material as they are presented. On December 31, 2023, the Pennsylvania Department of Health Bureau of Emergency Medical Services authorized several medications that could be administered by ALS providers during medical transport calls. These medications are albumin, clofidipine, esmolol, nicardipine, propofol, tranexamic acid, and blood products. This lesson will provide an overview of these medications for administration by paramedics during medical transport calls. Albumin is a protein produced naturally by the liver, and it plays a vital role in maintaining the balance of fluids in the body and transporting various substances through the bloodstream. Albumin is used to treat conditions where there is low blood volume or low albumin levels in the blood, which is known as hypoalbuminemia. Hypoalbuminemia can be caused by malnutrition, burns, major injuries, infections, or excessive kidney excretion. Albumin is also used to treat hypoalbuminemia in patients with severe injuries, infections, or pancreatitis when nutritional supplements are not effective. Additionally, it is used together with crystalloid treatment to correct lower osmotic pressure in the blood and replace protein loss caused by severe burns after the first 24 hours. Albumin may only be administered by intravenous infusion pump. You must appropriately document the medication concentration, dose, rate, and pump setting in your patient care report. Albumin will have different concentrations based on the patient's diagnosis. Common concentrations include 5% albumin in 250 milliliters or 500 milliliters of normal saline solution, 25% albumin in 200 milliliters or 300 milliliters of normal saline solution. Dose administration of albumin is based on the patient's diagnosis. You must verify the physician's order and current infusion pump settings. Side effects that may occur from albumin administration include blue lips and fingernails, chest pain, cough that may include pink frothy sputum, difficulty breathing and or tachypnea, difficulty swallowing, dizziness, tachycardia, hives, itchy skin, and rash, increased sweating. During albumin administration, you must monitor and document the patient's blood pressure at least every 5 minutes. Monitor the patient for signs of volume overload and congestive heart failure. Watch for shortness of breath and edema in the feet, wrist, hands, and face. Special notes to keep in mind when administering albumin. You must verify the concentration, dose, and rate for the infusion administration. Remember, this will vary based on the patient's condition and their diagnosis. Be sure to always verify the patient's weight that is being used for a weight-based infusion. Always verify the physician order, concentration, dose, and pump rate as part of your initial patient contact and assessment. If the patient experiences any changes or problems during transport, contact medical command for direction and medication dose changes. Clofidipine is a calcium channel blocker that is used to treat hypertension. Clofidipine may only be administered by intravenous infusion pump. Common concentrations for clofidipine are 25 mg in 50 ml of saline, or 50 mg in 50 ml of saline. Both of these formulas will yield a 0.5 mg drug in 1 ml of fluid concentration for administration. Clofidipine is not a weight-based dose medication. Typical administration dosages are 4 to 6 mg per hour or 16 mg per hour. Side effects that may occur during the administration of clofidipine are hypotension, bradycardia. In order to properly monitor for these conditions, you must obtain baseline vital signs during your initial patient contact and assessment before transport. Heart rate and blood pressure must be monitored and documented at least once every 5 minutes while administering clofidipine. Special notes to remember when administering clofidipine are: always verify the physician's order, the medication concentration, dose, and pump settings. If changes to the medication dose and rate are required, you must contact medical command. Esmolol is a beta blocker that is indicated for sinus tachycardia and supraventricular tachycardia, also known as SVT. It can also be used to control a fast heart rate and high blood pressure incident during and after surgery or other medical procedures. Esmolol can only be administered by infusion pump. Remember to document the administration of medications on the activity log on page 8 in EMS charts. Please refer to the ALS Documentation Expectations Guide for details on how to document infusion pump medication administration. The standard concentration for esmolol is 2000 mg in 100 ml of saline for 20 mg per milliliter. The infusion dose for esmolol is 50 to 200 micrograms per kilogram per minute. Side effects of esmolol can include hypotension, fatigue, dizziness, nausea and or vomiting, sweating. During esmolol administration, the heart rate and blood pressure must be monitored and documented every 5 minutes. Prior to transporting a patient with an esmolol infusion, verify the physician orders, concentration, dose, and current pump settings. All changes in dose require medical command contact. Nicardipine is a calcium channel blocker used to treat hypertension and angina pectoris. Nicardipine works by affecting the movement of calcium into the cells of the heart and blood vessels. As a result, nicardipine relaxes blood vessels and increases the supply of blood and oxygen to the heart while reducing its workload. In the medical transport setting, nicardipine will only be administered by intravenous infusion pump. Commonly supplied concentrations of nicardipine include 20 mg of medication and 200 ml of saline for a concentration of 0.1 mg in 1 ml and 40 mg of medication and 200 ml of saline for a concentration of 0.2 mg in 1 ml. Nicardipine is a non-weight-based medication with a typical administration dose of 5 to 15 mg per hour. Side effects of nicardipine administration may include arrhythmias, congestive heart failure, peripheral edema, headache, nausea and/or vomiting, dyspnea, palpitations, and anemia. You must monitor and document the patient's heart rate and blood pressure at least once every 5 minutes while administering nicardipine. Special notes to remember when administering nicardipine are: always verify the physician's order, the medication concentration and dose, and the pump settings during your initial patient contact and assessment. Contact medical command if the patient experiences any changes in their condition or requires a change to the medication administration dose or rate. Propofol is a general anesthesia medication used to sedate patients that require mechanical ventilation. Propofol must be administered by intravenous infusion pump. Common concentrations of propofol include 1,000 mg in 100 ml of saline for a concentration of 10 mg in 1 ml, and 500 mg in 50 ml of saline for a concentration of 10 mg in 1 ml. The dosing for propofol will range from 5 micrograms per kilogram per minute up to 50 micrograms per kilogram per minute. Side effects of propofol may include apnea, bradycardia, hypotension, nausea and/or vomiting, green urine. Precautions for administering propofol are: the patient must be intubated or have a tracheostomy and be on mechanical ventilation. Monitor and document the patient's heart rate, blood pressure, pulse oximetry, and end-tidal CO2 once at least every 10 minutes. Always verify the physician's order, the medication concentration, dose and the pump rate settings during your initial patient contact and assessment. You must contact medical command for any changes in the administration dose and rate. Tranexamic acid, also known as TXA, is a medication used to treat or prevent excessive blood loss in various situations. Tranexamic acid serves as an antifibrinolytic by binding to specific receptor sites on plasminogen, which is a protein involved in breaking down blood clots. By doing so, it prevents the conversion of plasminogen to plasmin, which is responsible for breaking down fibrin, the key component of blood clots. Essentially, it preserves the framework of fibrin's matrix structure, thereby reducing bleeding. The administration of tranexamic acid is covered in ALS Protocol 6094. It is specifically indicated for blunt or penetrating traumatic injury with uncontrolled bleeding and postpartum hemorrhage in emergency situations. Tranexamic acid may have different administration criteria for the hospital and medical transport settings. The normal concentration for tranexamic acid is 1,000 mg in 100 ml of saline, which will yield a 10 mg in 1 ml concentration. Tranexamic acid is a non-weight-based medication that should be administered at a rate of 10 mg in 1 minute, which would be 1 gram over 10 minutes. The administration of tranexamic acid may produce the following side effects: nausea, vomiting, and/or diarrhea, dizziness, mild skin itching and rash, urophobic feeling or feeling unusually happy. During administration of tranexamic acid, you must monitor and document the patient's heart rate and blood pressure at least once every 5 minutes. Always verify the physician's order, medication concentration, dose and the pump rate settings during your initial patient contact and assessment. Contact medical command for any changes in the patient's condition. Although not necessarily a medication, blood products including packed red blood cells, platelets, fresh frozen plasma, cryoprecipitate, and whole blood have also been approved to be administered by ALS providers. Blood administration under emergency incidents is specifically addressed in ALS Protocol 6095. The indications for blood product administration include traumatic injury with hemorrhagic shock, anemia, coagulopathy, conditions which are events that affect the patient's ability to produce blood clots, and platelet dysfunction. The administration of blood products can be accomplished by either gravity drip infusion or by intravenous infusion pump. Blood products are not a mixed medication, so they do not have a concentration like other medications that you might administer. 1 unit of blood product is approximately 500 milliliters of fluid volume. The administration dose of blood products will vary based on the physician's order for the patient's specific condition and presentation. During the administration of blood products, the following side effects may occur: The patient may develop a rash or experience mild itchy sensations. If this occurs, continue the infusion and contact medical command for further direction regarding the administration of the blood product. The patient may develop angioedema, which is a condition characterized by swelling that occurs deep within the skin or around mucous membranes. It typically affects areas such as the face, tongue, lips, throat, arms, and legs. The swelling results from fluid buildup and dilation of blood vessels. If the patient develops angioedema or stridor respiratory sounds, immediately pause the infusion of blood product and contact medical command for further direction regarding the management of the patient. If the patient begins showing signs of shock or hypoxia, immediately stop the infusion of blood product and contact medical command for further direction regarding the management of the patient. During administration of blood products, monitor and document the patient's heart rate and blood pressure every 2 to 5 minutes. Remember to always verify the physician's order, blood product and type during your initial patient contact and assessment. If the blood product is being administered by an infusion pump, you must verify the pump rate settings. Contact medical command for any changes in the administration dose or rate. The administration of blood products requires specialized blood administration tubing. You cannot use standard intravenous tubing for blood product administration. The blood administration tubing has 2 spikes. One is for the blood product itself and the second is for a normal saline solution bag. Blood products must be administered with normal saline. This process helps to prevent accidental clotting of the blood product during administration. The blood administration tubing will also have a filtered fluid chamber that the 2 spike lines will enter commonly. During the administration of blood products, you must monitor and document a complete set of vital signs which include heart rate, respiratory rate, blood pressure, pulse oximetry, and Glasgow Coma Scale. Additionally, you must assess the patient's temperature and skin, observing for signs of rash, during blood product administration. These ongoing assessment finds must be checked and documented every 5 minutes throughout the blood product administration. You must also watch for signs of hemolytic transfusion reaction. Hemolytic transfusion reactions occur as a serious complication during or following a blood transfusion. They occur when incompatible blood types are transfused. The patient's immune system recognizes the foreign blood cells and produces antibodies against them. These antibodies lead to the destruction of the new red blood cells, a process known as hemolysis. Even a minor mismatch in the patient's blood typing can trigger a hemolytic transfusion reaction. The more common symptoms associated with hemolytic transfusion reactions are back and flank pain, bloody urine, chills, fainting and/or dizziness, fever, flushing of the skin. These symptoms can appear during or right after the transfusion of blood products. Symptoms may also present several days later. This is known as a delayed transfusion reaction. If the patient displays any signs of a hemolytic transfusion reaction, immediately pause the blood product administration and contact medical command. As we begin to wrap up this presentation, let's spend a few minutes reviewing the proper documentation of intravenous access and medication infusions in EMS charts. All intravenous access locations on your patient must be documented on page 7 in the vascular access initiated prior to arrival section of EMS charts. You must document the following details for all intravenous access locations: the size of the intravenous catheter, the anatomical location of the intravenous access, and the crystalloid solution with the current administration rate. If there is no fluid running into the intravenous access point, the location should be documented as capped, indicating no fluids are running. Any medication that is mixed with a crystalloid solution must be documented in the medication and infusions section of EMS charts. Mixed medication solutions are not to be documented as intravenous access locations. You should document the intravenous access location as capped and then document the medication infusion in the medications and infusions section of EMS charts. Next, we will look at documenting running medication infusions in EMS charts. All currently running medication infusions for your patient must be documented on page 7 in the medication and infusions prior to assessment section of EMS charts. You must document the following details for all currently running medication infusions: the medication name, the concentration of the medication. Document the amount of medication in the volume of solution. As an example, 1,000 milligrams of medication in 100 milliliters of fluid, and then document the current dose rate of administration. An example being 40 micrograms per kilogram per minute at a rate of 23 milliliters per minute. Additionally, remember that any medications being monitored by a facility nurse must also be documented in this section. Also be sure to include the facility nurse as part of the crew on page 1 of EMS charts. All medication fact sheets for the medications presented in this lesson and all of the medications authorized for use by Keystone Quality Transport ALS providers can be downloaded from your employee portal. If you have any questions about the materials presented in this lesson, please contact the clinical operations team. You may now complete the associated quiz for this lesson, which is available in your employee portal.